Everything you're about to hear is for education and entertainment purposes only. Whilst we are licensed, we're not aware of your personal financial circumstances. Any advice is general advice. Equity Mates operates under Australian Financial Services Licence 540697.
Equity Mates!
I will say this about investing. Everything you do learn is cumulative. What I learned at 20 is useful.
Welcome to Uncovered by Equity Mates, a podcast where we shine a light on small to mid-cap companies that don't get analyst attention or media coverage. And today we are looking at Argenica Therapeutics. To chat through it as always is my equity buddy, Ren. How are you going?
I'm very good, Bryce. Very excited for this episode and very excited for our next iteration of Uncovered. We've been doing it for a while now, and rather than jumping straight into the interview, we're going to break down the company, talk about what we've learned, I guess. And then we're going to speak to the CEO and Managing Director of Argenica Therapeutics, Liz Dallimore. So a big episode and an interesting company that we're covering today.
That's it, Ren. So today's company, as I said, Argenica Therapeutics, the ASX ticker is AGN, is a pre-revenue pharmaceutical company that is acting in the stroke space.
Yes. They are working on a drug, ARG007.
Yeah.
This 007 doesn't have a license to kill, though. It's got a license to save and particularly try and save brain cells that are killed during a stroke. So I think let's take a step back and let's talk about strokes.
Yeah.
When it comes to strokes, there's a saying, time is brain. And the reason for that is during a stroke, blood vessels are blocked and oxygen can't make it to the brain. When your brain loses oxygen, it starts losing brain cells. Somewhere we read that a lack of oxygen kills 1.9 million brain cells every minute.
Yeah, pretty confronting.
I don't know how many brain cells we have.
I thought that as well when I was reading through this. I reckon billions upon trillions.
All right, 86 billion neurons according to my quick Google search.
Yeah.
So what are we talking, like less than 1% a minute?
Still. Yeah, you don't want any brain cells gone.
Yeah.
I wonder how many you lose in a concussion, a bad concussion. We'll take that offline.
Yeah.
Yeah.
So I think that is why they say time is brain.
Time is brain.
Because the longer that you're deprived of oxygen, the worse the outcomes are. There's I think it's called like a golden hour or something in strokes, like that first hour, getting intervention is critical. But then they talk about a 4.5 hour window for treatment.
Yeah, which I thought was much larger than I thought it was. I'd always had in my head that golden hour.
Yeah.
Yeah, which obviously is the most critical. But sadly, only 35% of patients suffering from an acute stroke arrive within that critical 4.5 hour window.
Yeah, arrive at hospital.
At hospital, yeah. So being able to do something within that 4.5 hour or stretch that 4.5 hour out is where Argenica Pharmaceuticals comes in.
So I think the traditional way that people have tried to approach this issue is, all right, we've got 4.5 hours. Well, we've really got an hour, but let's say the 4.5 hours. How do we get people there as soon as possible? And so we've spoken to another company in this Uncovered series, EM Vision Medical Devices, who are working on portable stroke detection technology so that they actually go on the ambulance to a stroke patient. Similarly, Victorian Health is trialling a mobile stroke unit. Again, the idea is how do we get patients to care quicker? It's bring the care to the patients rather than get the patient, bring them to the hospital. Argenica are asking a slightly different question. And rather than trying to get the patient to hospital within that 4.5 hour window, they've asked, how can we widen that 4.5 hour window? And that's where this drug ARG007 comes in.
So Ren, this started as a project coming out of the University of Western Australia, a current theme that we have with a lot of these these uncovered companies, born out of research at Australian universities. Love to see it.
Can I also just make the point that not the major two cities universities. We've had research from the University of Adelaide, University of Queensland, Queensland University of Technology, and I think multiple from University of Western Australia.
Yeah. great.
Yeah.
So, it started as a research project and then has now been spun out to now try and commercialize, or Argenica Therapeutics was spun out of this research project to actually start commercializing this. And in June 2021, it was listed on the ASX to go out and essentially raise enough funds to put this drug into development and take it through the 3 phases of clinical trials that we'll speak to Liz about.
Yeah, well, I guess a primer on clinical trials. Most clinical trials go through 3 major phases, and if you want to get your drug approved in any country, you really have to go through it. In Australia, the Therapeutic Goods Administration; over in the US, the Food and Drug Administration. Generally, phase 1 is a small trial, a few patients focused on safety. What are the side effects? How safe is it? That's what you're trying to answer. Phase 2 is a slightly larger trial, generally up to 100 patients, and that's starting to assess the effectiveness of the drug, sometimes in comparison to another treatment, sometimes in comparison to a placebo. Phase 2, you want to ask, does this work at all? Phase 3 is the larger trial, sometimes up to 1,000 patients, sometimes across different countries or different hospitals, different sites. With this phase 3 trial, you're comparing the new treatment to the best available treatment. And you really want to say, does this work better than what already exists? And so that's the process Argenica are going through, and that's why it was created, to take this drug through it. It commenced phase 1 trials in 2022, completed them at the end of the year, and reported to the market in 2023 that it sort of ticked everything it needed to tick, all the safety concerns. And so it moved to phase 2, and it kicked off phase 2 really quite recently. April 2024, it dosed its first 5 patients. So very early days of phase 2. But that's sort of where the company is in its, I guess, clinical approval journey.
Yeah, we'll pick that conversation up with Liz. So, Ren, let's have a quick look at the financials. We said that it's pre-revenue, so it's not actually making any revenue from selling ARG-007. As with most pharmaceutical companies, the revenue at the moment is coming from R&D and tax. Sorry, most pharmaceutical companies at this stage,
yes.
at that research and development pre-commercialization stage, a lot of the revenue that they get is from R&D, tax incentives, government grants, those sorts of things. Obviously, with the idea that it's commercialized at some point.
That's the cutting insight that Liz is coming to us for. But look, I think the important thing is, for a pre-revenue company like this, what's its balance sheet like? Does it have the money to see it through? And we're going to ask Liz that question directly. But I think when researching Argenica, one thing that it was impossible not to notice is that for a company that is making a loss every year and is pre-revenue, the cash on its balance sheet keeps growing year after year. And that's because it's fundraised every year. So it IPO'd in 2021 and raised $7 million from investors. Then it had a $5.5 million placement in 2022 and a $4 million placement in 2023. So they can fundraise.
Yeah. Hold on.
I actually don't know how much money, like phase 3 clinical trials are expensive. So
let's ask Liz.
Yeah, they have 9 mil on their balance sheet at the end of last financial year.
Yeah.
Yeah, let's see what they need.
And they're losing, what, $4.5 million a year?
Spending.
Yeah. So runway is tight. I mean, the faster you can get this to commercialization, obviously the better. But we'll ask Liz.
Whether or not this company succeeds, gets through clinical trials, like it's a big problem. And like some of the numbers around the scale of the problem are pretty confronting. So every 19 minutes, someone has a stroke. In 2019, that was 13 million people globally. But here is the most confronting number I came across. 1 in 4 people will suffer a stroke in their lifetime, and only 10% will recover almost completely.
Both of those stats are crazy.
Yeah.
1 in 4.
1 in 4, yeah.
Globally or in Australia?
I think globally.
Wow.
Yeah.
And only 10% will recover completely. Almost completely.
Yeah. So
big problem.
Like companies like Argenica, other companies, we mentioned EM Vision working on a different approach to the challenge of strokes. Like it's kind of scary. So it's good that they're working on it.
Yeah, I'm really enjoying doing this this Uncovered series and seeing a lot of these companies come out of A, Australian universities, but B, tackling meaningful health problems and giving us a lot of hope that there are very smart people out there working on what could be very meaningful solutions to some of these things. So that's a good time to pick up Liz. Let's bring her in.
Uncovered.
Well, Liz, welcome to Equity Mates.
Thanks so much for having me, Bryce and Alec. It's great to be here.
So, Liz, we're a community of investors, and this series is all about shining a light and understanding the story of small and mid-cap Aussie stocks. So, in 60 seconds, I've got my stopwatch here. How would you pitch Argenica?
So, okay, quickly, Argenica is probably one of only a few global neurology companies addressing ischemic stroke and a neuroprotection drug. So we are now fully funded. We're going into a phase 2 clinical trial and some really exciting upcoming milestones coming up. So exciting time to be part of the company.
Awesome. 24 seconds that was.
You've absolutely nailed the brief.
Okay, much longer.
We've spoken to some CEOs.
There's more I can talk about. So.
Some CEOs we speak to, they couldn't get anything in under a minute. So we're impressed you could get that pitch done. And look, there's probably a number of threads that we want to pull out there. We want to pull on the actual drug ARG007, what you're creating. We want to pull on the thread there you said about fully funded and how you're thinking about that. But I guess let's start by talking about the clinical trials that you mentioned. You mentioned you're in phase 2 clinical trials. So I guess help us understand what that means for those not in the pharmaceutical game, and I guess what are the major milestones and timelines for us to be watching going forward?
Yeah, sure. So I guess your listeners that aren't familiar with drug development process, so there are a number of sort of regulatory hurdles that we need to tick off as we're developing the drug. And it's largely around looking at sort of safety of the drugs. Yeah, so the first stage of that is to test the drug on healthy people. So this is what we call a phase 1 clinical trial, and we get healthy volunteers coming in that essentially volunteer themselves to have the drug administered. So we've done that. The drug has proved to be safe, well tolerated in those healthy people. And now, as I mentioned, we're going into what's known as a phase 2 trial. So this is where for the first time testing the drug in stroke patients. So patients that are coming into emergency departments across Australia will deliver the drug to them. And again, mainly looking at safety in this clinical trial. So this is, again, as I said, a big regulatory hurdle for the TGA, making sure the drug is safe. But in this trial, we'll also be looking at how well does the drug actually protect against brain injury in these stroke patients. So that's the second part. And then the third part is undertaking what's known as a phase 3 trial. That will be a big global trial where we'll activate sites across the world, and really similar in terms of the design from our phase 2 trial. So ischemic stroke patients coming into emergency departments across the world, delivering our drug. And that one, we're primarily looking at the ability of the drug to protect brain cells. So it might sound like a long process, but just want to point out to your listeners that we have been on this journey for 12 years. So a lot of the drug development process happens in the early stages, in the preclinical, in the lab, where we're really de-risking the asset so that once we put it into humans, we've got a pretty good idea that it will be safe, that it, and that it could potentially show this efficacy as well.
So let's talk about neuroprotective drugs. That's a new term I've learnt while researching your company. I guess give us, to start with, the 101 on what you're trying to do with ARG007, and then maybe a little bit about the lay of the land. Is anyone else working on this challenge, and where are they at as well?
Yeah, so neuroprotective drug, it just means neuro, meaning the brain, and protective, meaning protecting. So we're trying to develop a drug that is able to protect the brain following stroke. So If you know someone that's had a stroke, you can kind of pick those telltale signs of what those sort of functional deficits are. So they may have sort of the drooping face, the inability to sort of talk properly. They might have sort of palsy on one side of their body. And that is really caused from cell death or brain cell death following the stroke. So we're talking about ischemic strokes here, and these are strokes caused by a clot in a blood vessel in the brain. And so when you get that clot in a blood vessel, it stops blood flow going to that part of the brain. The blood carries oxygen, and brain cells need oxygen essentially to survive. So as soon as you get that lack of oxygen, brain cell death really starts occurring within about 3 seconds post-stroke. So what we are trying to do with this drug is to hibernate brain cells following an ischemic stroke. At the moment, the only treatments available for patients address the clot itself, so really looking at how they remove that clot. That can only be done in hospitals. So the idea of a neuroprotective drug that can be given to patients soon after a stroke has kind of been the holy grail of stroke research and really sort of what I guess clinicians really want to see. So buying that patient, not only sort of protecting their brain, but also buying them time to get to the hospital and get the treatment they need to remove the clot. So it's an exciting time. There has been a lot of work done in neuroprotection historically, but a lot of those drugs proved unsafe. So there was toxic elements to them. They would hibernate these brain cells pretty much permanently. So we know obviously that is no good. You need those brain cells to obviously be hibernated for a period of time but start working again. So our drug is really has the ability to do that, which is a really unique, what we call sort of mechanism of action of the drug. So globally, there's only a couple of companies that are actually in phase 2 trials in stroke. So not a huge amount of competitors out there. And really, I think because, we have been working on this drug within a couple of research institutes in Perth for, as I said, 12 up to 12 years now. So huge amount of research behind us that really has allowed us to sort of de-risk the asset, look at the safety and get it to this point.
This is probably going to go too much into the weeds, but just thinking about how you're telling brain cells to hibernate, what is that? Like,
what does it do?
Because I'm assuming they're still starved of oxygen, so that's like point one, and so it's kind of like you're coming in and just trying to slow down the process of it dying.
Exactly. Yeah. So what happens? And I love the weeds. Happy to get right into them. So essentially, what happens is when you have that lack of oxygen to the brain, you get a flooding of glutamate. Glutamate is a neurotransmitter that our brain needs for normal functioning, but it just starts to accumulate on the outside of the cells. And when that happens, this glutamate activates little channels that are on the cell surface and causes them to open, and calcium starts flooding into the cells. And it's essentially this that causes the brain cells to die.
Right.
And when they die, it sort of becomes then this cascade. So you get more release of glutamate, more activation of these little channels on the cell, more calcium influx, and it just keeps sort of cycling. So what our drug does is it's actually essentially sort of binding to those little channels and pulling them inside the cell surface for a period of time. So stopping that calcium influx channel essentially getting into the cells. But what's really cool then about the drug is that it only works for a period of about 12 hours. So then those little channels cycle back to the cell surface at a period, point in time where blood flow's been restored, the patient's had the clot removed, treated, and so starts to just work normally, which is really important because you do need a bit of calcium in the cells, you need a bit of the glutamate, you need these channels to keep working for normal, healthy brain cell function.
Nice. Good weeds.
Does that make sense?
Yeah, absolutely makes sense and continues to amaze. It just continues to amaze me what people can do in the field of medicine. So, So, Liz, you've been remarkably successful at raising money. IPO'd in 2021, a placement in 2022 and 2023, and another one upcoming. How do you think about your balance sheet, and how much do you need to actually get through phase 2 and phase 3? I imagine these are not cheap parts of the cycle of commercializing drugs like this.
No, that's absolutely right. So we're pretty frugal, though. That's one point I will make. We do a lot for a little at Argenica. I think we've had some really good capital and financial management, and we don't take it lightly that, essentially we are sort of taking shareholders' money really to help us progress. So we want to do that in the most cost-effective way. We have just completed a $12 million raise, which is essentially able to really get us to the end of that phase 2 and have enough money in the pot sort of post that phase 2 to really look at sort of what we'll be looking to do in that phase 3 clinical trial, presuming that the phase 2 obviously is successful. In terms of the capital raises, they haven't been, absolutely huge. We've sort of just taken the capital that we need at that point in time to really sort of make sure that we can keep delivering on these milestones. Our focus with that capital is really around that phase 2 trial. The other indications that we have, so the traumatic brain injury, the Alzheimer's disease and the HIE, are very much grant funded. So we've sort of been able to attract over or close to $5 million of non-dilutive grant funding to progress those indications. And we'll always try to find as much non-dilutive funding as we possibly can. So, obviously really grateful for our shareholders. The last raise was very much focused on getting institutional investors into the story. We sort of just had been in a bit of a retail play before that. And so really, and the benefit of having those institutional investors on the register is, they've got deep pockets, they're hugely supportive, they're sticky investors, and they can really sort of help us as we sort of start hitting milestones. And, they'll buy on market. So really, from a retail point of view, it's really important that companies at our stage get those institutional investors on the register.
Yeah, nice. Well, congrats.
Yeah, it's a fascinating story, and one that we love to watch play out. Not least because one of the confronting stats we came across when researching for this was that 1 in 4 people globally will have a stroke in their lifetime, which is just crazy. Yeah. So I guess, we're wishing you all the best with these trials and, all of this research coming out of Australian universities. We hope to see succeed. We want to, finish with a question about what it looks like long term, because we're long term investors here, and this is a long term process that you're undergoing. And so, if you are successful, what does Argenica look like in sort of 10, 15 years? But also, I'm interested to know how this drug is used in your mind if it is all successful, because right now you're dosing patients when they come to hospital, but is this something where it's going to be in public places, there will be this drug so people can have it as soon as they start having a stroke? Will it be like defibrillators at the local pool and the local library and stuff like that? So I guess what does this look like in 10 years if everything goes to plan? So ultimately our goal is that this drug is in every ambulance. So not sure I'd want a patient to administer it at the moment. Obviously when a paramedic arrives, and those telltale signs of when someone's having a stroke you call the ambulance first and foremost. So all the raw flying doctors or whatever it may be. So one of the big challenges at the moment with stroke care is that these large strokes, you have to get them to a stroke centre, which is in the metro area. So, someone sort of having a stroke in, the Northern Territory or say Broome, for example, they've got quite a long delay from stroke to where they're actually coming into these centres. So, if we could have a drug like this that really sort of shuts down the brain and protects the brain, buys that patient time,
that this drug is in every ambulance, every Royal Flying Doctor, and not just for stroke, but, the exciting data that we have on traumatic brain injury. If someone's in a horrific car accident or, domestic violence where they've sustained a significant TBI, that, paramedic arrives and they still have the option to use this drug. Also, say cardiac arrest, the reason that a lot of patients die from a heart attack is because of lack of oxygen to the brain and brain cells starting to shut down. So we see the optionality is absolutely massive. So neuroprotection is such a huge, all-encompassing market. If we could have a drug like this in every ambulance that has optionality across a number of neurological conditions, then we'll be onto something absolutely huge, absolutely amazing. We just have to go through that sort of process of obviously clinical trials. Just for your listeners love to hear that they're long-term holders, which is fantastic. That's what we love. Small caps companies love those very supportive shareholders. Is, really sort of post-phase 2, we'll be looking to sort of global pharmaceutical companies that we can potentially partner with on that journey. So as we move into a global clinical trial. So starting to have those conversations at the moment with pharma companies to see how we may sort of collaborate and work together on that larger phase 3 trial as well.
Would this have utility in like concussion treatment?
Yes. Yeah. So we've just got a concussion study running at the moment, and this has been funded very generously through a federal government grant. So looking at the optionality for concussions. So in that case, we would look at a bit more of an over-the-counter, say like a nasal spray or something, where patients could administer it themselves, because, putting an IV line on the sideline of the footy field is not the best way to deliver a drug. So we've got really good data in the more severe TBI, but trying to expand that out and look at the potential in concussion. So because it is, concussion is horrendous and obviously getting a lot of press, but it's really, once you sort of sustain that big knock, that big concussion, the damage starts almost instantly. So you get the inflammation in the brain, you get the accumulation of proteins. And so we know that our drug does work on those key processes associated with concussion. So fingers crossed we get some good data out from that and we can look at how we progress that.
Well, thank you so much, Liz. Really looking forward to seeing how these phase 2 trials close out and then moving into phase 3. Obviously some really important work that you guys are doing that affects 1 in 4 people. So I appreciate you coming on the show and all the best with it. Thank you very much.
Thanks so much, guys.
You have been listening to an Equity Mates Media production. In the spirit of reconciliation, Equity Mates Media acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respects to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. This podcast is intended for education and entertainment purposes. Any advice is general advice only and has not taken into account your personal financial circumstances, needs, or objectives. Before acting on general advice, you should consider if it is relevant to your needs and read the relevant product disclosure statement. And if you're unsure, please speak to a financial professional. The hosts of this podcast and their guests may have positions in the companies mentioned. Equity Mates Media operates under an Australian Financial Services Licence 540697.